Good morning. I would like to welcome you on our latest webinar about the full eye approach with Retix.C treatment. The eye area is very unique. We need to always focus on the eye area because it doesn't matter what kind of other problems, other blemishes we have on our skin, but the eye area is always something that we are seeing at the first, considering the aging process. We can see fine wrinkles, we can see dark circles, we can see eye bags, and we are always having some kind of problems with the right tightening effect on the upper eyelid. So, what is also very important, except of the fact that we need to focus on eye area, the skin on this area is very, very sensitive. It's thin, so always when we are starting to work with eye, we need to focus ourselves not to cause big inflammation because this part of our body is really, really, really sensitive. Also, what is very important, we need to always focus ourselves on inflammation process. So if we are causing some kind of inflammation, we are always thinking that we can run the aging process faster and we are not going to work right thinking about the eye area. Our treatment, Retix.C treatment, is the one that we can deliver to our patients, to our clients, to have those two important bases. First of all, the treatment is very, very intense and we are seeing immediate results, and we can also cure a lot of problems that we are expecting to see on the eye area. But on the other side, we are always focusing to stay safe, not to cause the inflammation, not to cause the oxidative stress, and then to run the inflammation process. What is eye plus treatment? The eye plus treatment, it is a box of 3 steps procedure that we are making in the professional field in our clinic. First of all, the first step, it is a chemical peel. It's a mixed chemical peel that we're starting to work with to condition epidermis. We're going to speed up the right processes that are running in the epidermis. We are going to speed up the turnover time of cells in the epidermis, and the skin is going to look brighter. It will be more tight, and we are going to speed up the right metabolism processes. The second step of the procedure are ampules. The ampules are sterile. This is a very, very important part because if we know that the ampules are sterile, we will know that we can make the procedure in 2 different ways. We can do it as a party effect, only topical, and we will massage this ampule all over the area, or we can provide the microneedling mesotherapy on this ampule because of the fact that the ampule is sterile. And the third step of the procedure is the biocellulose patch mask. This mask, first of all, is going to cover any risk of inflammation, but except that fact, it is going to reduce the eye bags all over the eye area. When we are opening the box, we have the full protocol about the treatment, how to make it step by step. So it is very, very easy and clear how to perform the right treatment. And the box contains 6 treatments, so it will be actually 2 sessions, 2 full sessions for 2 patients, because we are recommending to make the session with 3 treatments for each patient. What is so important about the Retix.C Eye Plus, except of the fact that we said that we are going to have this intense treatment, and also we are going to be very, very safe at the same time. As I said before, we can provide 2 different types of protocols depending on the fact what kind of procedure we want to achieve, what kind of effect we want to achieve. First, we can make like a party, like a banquet procedure. All the steps we are going to make topical. So first it will be a peeling. We are putting 3 layers on the peeling, 3 minutes in between each layer. And after that, because the pH of the peeling is 3.6, we are going to remove it only with the pure water. We don't need to use the neutralizer. It will make this itching sensation, and the eye area is very, very sensitive. So it is always better to use pure water in this case. Also, what is very good to do, how I can recommend neutralizing process on the eye area. I am always putting like my hands in the water, and I am making some kind of massage through the eye area. So it is always more pleasant for the patient to make this kind of neutralization process. The second step of the procedure that we are making during the party treatment, we are getting this ampule, the second step of the procedure, and we are going to provide the massage all over the eye area for about 7-10 minutes to make the product get deeper, to increase the microcirculation. And after that, the third step of the procedure will be the biocellulose puff mask that we are going to put at the end to get this great tightening effect and the right procedure. This is something that we are going to do for the patients, for the clients that want to look good today or tomorrow. They have some kind of important event. The skin is going to look better, the makeup is going to stay longer, but we are not expecting a long-term results. If we want to get the right action of eye plus treatment, it is always better to work on the second step with microneedling mesotherapy. The microneedling mesotherapy we're recommending to work with our AirPen device. So we are going to make it with the AirPen device. Always we need to be safe on the eye area because of the fact that the skin is very thin. So we are not working very deep. We are working from 0.1 to 0.3 millimeters, working with microneedling in this area. So after the peeling, when we are thinking about the right anti-aging result, anti-hyperpigmentation, if we want to unify the skin tone, if we want to reduce the dark circles all over the area, if we want to make the lifting effect on the upper eyelid, always try to work with microneedling. It is not only because of the fact that microneedling is making channels in our epidermis, so the product is getting deeper, but also because of the fact that microneedling mesotherapy is increasing the right processes that are running in our body. It is going to stimulate collagen production. It is going to stimulate the activity of fibroblast. It is going to make the skin thicker, and the quality of the skin is going to be better. So it's always better to combine the ampule with microneedling mesotherapy. Our device, our AirPen device, we can use microneedling mesotherapy, but also the LED light at the same time. So we can adjust the LED light on the AirPen, and we are deciding which type of light we want to use. We have 7 different types of light. In this case, I am recommending to use the red light because it is going to work as an anti-aging. So we have 2 ways, except of the product, how to make the right anti-aging action. When we are ending the microneedling mesotherapy, of course, the skin can be a little bit red because of the needling, but we are making the third step of the procedure, which is a biocellulose puff mask. We're putting this mask on the eye area, and except of the fact that we are going to reduce the eye bags, we are producing inflammation. We are going to make the calm down effect on the skin. What is very interesting in this mask is the fact that it is not cutted like a holes for the eye, but we are making like a U cutted. So we have the puff that is going to cover the upper eyelid. So you will see in a minute our video about the full protocol with microneedling, and you will see that we have a unique protocol, unique technique that we can work with our device, also very, very close to the eyelashes, the lower eyelid, and also very, very close to the eyelashes on the upper eyelid. If I have some kind of inflammation on the upper eyelid, my mask is also going to cover this problem without any doubts. So it is very interesting to have this kind of mask at the end, because even we are making microneedling at the beginning, the client is leaving the clinic with good quality without the big inflammation on the skin. So the skin is not going to be red or swollen. It is not causing an erythema or edema. The mask is going to provide the calming down effect for sure. What kind of active ingredients do we have in our products? It is very important because we have different types of the procedures on the market for the eye area, but they are divided in two groups actually. First, invasive, intense procedures like injectables or some kind of devices that we know that we will need to make a gap to stay at home for like 1 week after, because the skin is going to look really like after some kind of invasive procedure. It will be it will cause like inflammation. And then we have very light procedures, only massage or peeling, like light peeling. Our eye plus treatment, it is something in between. We have a really great action. We have great studies on that. We have a really great intense action when we are working with microneedling, but at the same point, we are working on antioxidant action. So we are reducing the oxidative stress, we are reducing the inflammation, so we can provide at the same point very spectacular effects after the treatment, but we are not going to cause the inflammation and we are not going to cause the inflammation. So the aging process that is going to stay because of the fact that we are running a long-term inflammation in our body. First step, the peeling. The peeling contains different types of acids. We have malic acid, we have citric acid here, we have lactic acid, we have ferulic acid, and we have palmitate retinol. The palmitate retinol is a specific type of retinoids that is very safe for this area. It is going to shorten down the turnover cells on the epidermis, so we're going to have a great quality of the epidermis, but it is not going to cause us a big risk of inflammation. So this is something which is very important. With this peeling, we are going to get the stratum corneum out of the skin. We're going to see the great quality of epidermis. We're going to condition the epidermis, but without the big peeling effect, without the big risk of inflammation. After this step, we are starting to work with the ampule. And here what we have ferulic acid. We have 10% of vitamin C, biological active form of vitamin C. It is glucosic ascorbate, so it is going to work great for tightening effect, for anti-aging effect, and also it is going to unify the skin tone. We have niacinamide here, so a great active ingredient to give us the anti-aging results, but also anti-hyperpigmentation. And we have lactic acid as well. So we are going to have a moisturizing effect. All the ampule is also working for the oxidative stress reduction and to give us the right protection for the skin of eye area. And the puff mask at the end, we are going to work with this mask to calm down the effect of any inflammation and also to work on the eye bags. What is very important thinking about those active ingredients, it is the fact that, as you see, all of them are giving us the opportunity to work all year round, but it is not only that we can make the treatment during the summertime. It is those active ingredients that we have in all the steps of the procedure. They are protecting the skin from the environmental conditions, from the sun exposure. So it is not only that we can use it during the summertime, but it is very good to use it during the summertime to protect the skin from sun exposure and other environmental conditions. Now I would like to invite you to see the short video about the full procedure, how to work with eye plus treatment. It is going to be the one with microneedling, our unique technique, how to work with AirPen device very close to eyelashes to cover the whole problem of lower eyelid and upper eyelid. Also, what is very important, this treatment is not only for upper eyelid and lower eyelid, but we can also work on the both sides, on the part of our face between the brows when we are making this kind of moves, and we are always focusing on the wrinkles over there, and also more or less 2 centimeters above the brows. So let's see the video with the whole protocol. Okay, so we have seen the video, we have seen the protocol, you know exactly how to perform the treatment. And now we need to know what to recommend to our patient, what to use at home. Because we always know as a specialist that it is not only the professional treatment. We always need to think about the home care product, the professional home care treatment. Because if we are going to use only our professional field, it is not enough to get the great effect and great quality of the skin. So, the full session of eye plus treatment is going to be 3 treatments, 10-14 days in between. If the patient wants to make more treatments, it is totally okay to make 2 sessions right after. So we can make 6 treatments, 10-14 days in between, but the regular full session, it is going to be 3 treatments. And in between, what we recommend in between, it is always going to be SPF cream, photoprotector SPF 50+. It is the one that is going to give us the full protection. And also, it was tested on this particular eye area and it's not causing the inflammation. So it is going to be really, really safe to use it in between the time that we are performing eye plus treatment. And also very good from the range of the professional home care products of Retix.C is going to be a Hello Magic Serum, because here we have 4 different forms of hyaluronic acid, 4 different sizes of molecule of hyaluronic acid. One of them is cross-linked, so it is going to provide us quite some kind of film on our skin. It is going to close the skin, and it's not going to the environmental conditions are not going to be unsecure for the skin. So it's always very good to make the Hello Magic Serum, to provide the Hello Magic Serums few drops right after the procedure, the professional treatment, but also to use it at home, and always photo protection, not only on the eye area, but of course on the full face approach. What is also very interesting with the eye plus treatment is the fact that we can link this treatment with more invasive medical protocols. So, for example, we can use eye plus treatment at the same session with radio frequency microneedling. We can link this treatment with injectables at the same session to get more the better efficacy, because here we are going to condition the quality of the skin. We are going to make the skin brighter. We are going to see the skin tighter. We are going to see that we have this lifting effect on the upper eyelid. We are going to make the wrinkles, the fine wrinkles, more superficial. If we want to adapt this with medical protocols, we are going to get more intense results, but more safe, because this product is going to give us this antioxidant protection. So if we are causing the inflammation with medical treatment, this one is going to slow down the oxidative stress, so we're going to be more safe. For example, if we are going to make the eye plus treatment with microneedling radio frequency, we're going to start with the peeling. Then we are providing the massage with the ampule from the second step of the box. Then we are making the device. We are making the regular treatment with microneedling radio frequency. And then at the end of the procedure, we are going to cover the eye area with the bath mask. If we want to link the eye plus treatment with injectables, we are going to start with the chemical peel to increase the quality of the epidermis, to remove the stratum corneum. Then we are going to make injectables, hyaluronic acid, stimulators, botulinum toxin. Then we are going to get the second step of the eye plus treatment, and we can provide it with microneedling, with regular microneedling mesotherapy. And at the end of the procedure, we're going to cover the whole area with the biocellulose bath mask to reduce the risk of inflammation. I hope this webinar was interesting for you. I hope you are going to feel secure and fine, free to start to collaborate, to work with the full eye approach by Retix.C with the eye plus treatment. If you will have any questions, any needs, don't hesitate to ask us. And of course, see you next time on our next webinar.